Basic Serologic Laboratory Techniques and Clinical Applications. Here are your learning objectives. All right, so the procedures manual. Purpose is to ensure laboratory personnel have immediate access to up-to-date techniques and approved policies for serology testing, or really any testing in the laboratory, but this is for serology and immunology. And also we want to maintain compliance with recognized standards like CLSI. Some requirements is we have to have the availability of documentation. So we have to have a complete document that must be accessible at all times at the immediate bench area where laboratory work is performed. This ensures quick reference during testing procedures, minimization of errors, and adherence to approved protocols. The content of the document has to include current serology techniques like ELISA, agglutination, complement fixation, immunofluorescence, and rapid testing. The approved policies and procedures, so there are standard operating procedures and quality control guidelines and safety protocols and biohazard handling. For compliance standards, it has to comply with CLSI format. So CLSI is the Clinical and Laboratory Standards Institute. The document must follow the CLSI formatting and guidelines, including clear headings and numbering, stepwise procedural instructions, documentation of reagents, equipment, and QC measures, references to applicable regulations and quality standards. The importance of this is it has a safety component to it. It reduces laboratory accidents and exposure risk. Accuracy helps to ensure test results are consistent and reliable. Also helps with efficiency, so laboratory personnel can perform tests without delay. Also helps with regulatory compliance, so it meets external audit and accreditation requirements. Best practices for this, so we want to regularly review and update the document to include any new serology techniques, any changes in the regulatory policies, or if there's been any updated QC or safety procedures. We're also going to train all personnel to familiarize themselves with the document, and we're going to maintain a physical or digital copy in the bench area that is easily accessible to everyone. So blood specimen preparation. So the purpose of this is to ensure proper handling, processing, and storage of serum specimens for serology testing. It can help maintain sample integrity and compliance with laboratory protocols. So the collection and clotting of the serum. So we're going to have the collection tubes. We're going to use anticoagulated evacuation tubes as specified in the protocol. The choice of tube may vary depending on which test is actually ordered. For clotting, we're going to allow the blood to clot either at room temperature or in the refrigerator. Again, that's going to depend on the specific protocol and procedure. For serum transfer, so after clotting, the serum should be carefully transferred into a labeled transfer tube. And the label must include, the patient identification, date and time of collection, and the type of specimen that is going into that tube. For storage and testing, so for short-term storage, the testing should ideally be completed within 72 hours of collection. For long-term storage, beyond 72 hours, generally you can freeze it at -20 degrees Celsius or according, once again, to that specific protocol. We want to avoid repeated freeze-thaw cycles to help maintain that sample integrity. There are some special procedures in the serology lab. So the first one is the heat inactivation. And some serology tests may require heat inactivation of complement in the serum. This typically involves heating at a specific or specified temperature for a set amount of time. Again, you're going to follow your specific protocol and instructions carefully to ensure that you do it appropriately. For specimen types and acceptability, so this purpose is to understand which specimens are appropriate for serology testing and to also recognize factors that may affect test accuracy and specimen acceptability. So different types of specimens. So the primary specimen is usually serum. That is the most commonly used specimen for serology assays. Some alternative specimens may be other body fluids. It's going to depend on the test protocol. So some examples of that could be like your cerebrospinal fluid, synovial fluid, and urine. For specimen acceptability, so unacceptable specimens, so specimens that are lipemic or high in fat content, hemolyzed specimens, the ones that have the ruptured red blood cells, and ones that are bacterially contaminated could all be compromised, and that could actually compromise your assay accuracy and should not be used. Potentially interfering specimens, so icteric, the ones that have high bilirubin or turbid serum. They could yield a valid result for some tests, but they may interfere with other assays depending on the test sensitivity. So the best practice is to inspect specimens for clarity, color, and contamination before testing. You want to make sure you follow the protocol-specific guidance for handling specimens with minor interference. You're also going to document any specimen issues in the laboratory record. Complement inactivation. So the purpose is to understand the inactivation of complement in the body fluids. This helps to ensure accurate serology testing by controlling complement activity. The definition, so we have inactivation, which is the process that destroys complement activity in a specimen. Complement activity, if not controlled, can actually interfere with certain serological assays. So the inactivation procedure, so we have a standard method. It's usually to heat the body or the serum at 56 degrees Celsius for 30 minutes. This effectively destroys the complement activity while preserving the antibodies that we are going to test in the serology lab. For reactivation, so if more than 4 hours have passed since initial inactivation, the specimen can be reactivated by heating at 56 degrees Celsius for 10 minutes. This ensures the specimen is ready for assays that require controlled complement activity. For the best practices, we can use a calibrated water bath or heating block to maintain that 56 degrees Celsius precisely. We want to, again, make sure we label our specimens clearly with inactivation time and date. We're going to follow those procedure-specific protocols regarding the inactivation to maintain the test accuracy. So just a quick summary, we have complement inactivation, which is essential for certain serology tests. Standard protocol, once again, is 56 degrees Celsius for 30 minutes. For reactivation, we can do 56 degrees Celsius for 10 minutes if it's been greater than 4 hours time frame. Proper handling will ensure reliable and reproducible results. So pipettes, there are different types of pipettes that are used. So the purpose of this is to understand the different types of pipettes used in serology laboratories. This will help to ensure accurate measurement and transfer of liquids during the assays. So the different types of pipettes that we use is a manual graduated pipette. This is a glass or plastic pipette with graduation marks for measuring variable volumes. It's used for transferring different volumes of reagents or samples and requires careful visual reading at the meniscus for accuracy. Then we have manual serological pipettes. This description, so we have pipettes that are designed specifically for serological assays, often with a larger diameter and single or double markings. These are used commonly for blood serum or other body fluids and may require a pipette aid or bulb for aspiration and dispensing. And then we can also use semi-automated micropipettes. These are adjustable or fixed volume pipettes designed for small volumes like a microliter with high precision. These are ideal for ELISA, immunoassays, and other microvolume procedures. It actually helps reduce human error and increases reproducibility. For best practices for pipetting is to always calibrate pipettes regularly according to the CLSI or manufacturer guidelines. And we're going to use appropriate pipette tips to prevent contamination. We want to avoid air bubbles for accurate measurement. And we also want to label and store pipettes properly when not in use. So just a quick summary, we have pipettes are essential tools for serology for accurate and precise liquid handling. Types include manual graduated, manual serologic, and semi-automated micropipettes. Each are suited to their own specific task and volumes. So proper use and maintenance can ensure reliable assay results. All right, so automatic pipettes. So to understand devices that allow fast, repetitive measurement and delivery of equal volumes in serological assays. They can help to improve accuracy, efficiency, and reproducibility during testing. So the types of repetitive liquid handling devices, we have micropipetters. These are adjustable or fixed volume pipettes for precise small volume transfers. These are, once again, ideal for ELISA, immunoassays, or other microvolume applications, and can deliver multiple aliquots quickly and consistently. For automatic dispensers or syringes, these are mechanicalized devices that dispense fixed volumes repeatedly. They are suitable for larger volumes and reduces operator fatigue and improves throughput in routine assays. For diluter dispensers, these are devices that dilute and dispense solutions simultaneously. These are common in serological titrations or assays requiring serial dilutions. This ensures consistent dilution factors and delivery volumes. These ensure devices are calibrated regularly to maintain accuracy for all these types of pipettes we talked about. You're going to want to use the appropriate tips, syringes, or dispensers to avoid contamination. And once again, we're going to follow those manufacturer or CLSI guidelines for maintenance and operation. All right, so dilutions, we use these to ensure accurate test results when working with concentrated or reactive samples. A dilution factor is the ratio of volume of specimen to the total volume after dilution. So an example is we have 1 milliliter serum plus 9 milliliters of diluent will equal a dilution factor of a 1 to 10. For single dilution, this involves one step of dilution from the original specimen, and this is used when the concentration is moderately high or when only one dilution is needed for testing. So the use of dilution factors, so this helps standardize results across different laboratories and assays, and it helps avoid saturation or interference in tests due to high concentrations. For serial dilutions, we have a stepwise dilution in which the previous dilution is further diluted. So the purpose of a serial dilution is to determine endpoint titers in antibody testing. It helps to ensure accurate measurement of highly concentrated specimens. So an example is you would have a 1 to 2 dilution, which would then go to a 1 to 4, a 1 to 8, a 1 to 16, and so on. So some best practices for this is to ensure that you use proper pipettes and diluting devices to ensure accuracy. We want to make sure to label each dilution clearly to prevent mix-ups. So if you did a 1 to 4, make sure you label that. And then if you record dilution factors and calculations in your laboratory notes, so make sure you document what you've done. So in summary, we have dilutions are essential for accurate quantification and titration in serology. And we have careful techniques and documentation, which are, crucial for reliable results. So principles of your antibody levels. This is to understand how antibody levels are measured in your patient specimens. So to interpret results accurately using titers and paired specimens. So our type of specimens is we have an acute phase specimen. This is collected early in the course of an infection, so usually within the first few days of symptom onset. This will reflect the initial immune response. And then we have the convalescent phase specimen. This is collected after recovery, so typically 2 to 4 weeks later. And this is used to detect rising antibody levels and confirm infection. An antibody titer. So the definition of an antibody titer is it is the reciprocal of the highest dilution of the patient's serum in which the antibody is still detectable. So an example is we have, let's say, a serum, and it remains positive at a 1 to 64 dilution, but negative at a 1 to 128. So the antibody titer is actually a 64 because that was the last time it was positive. The next time you did another dilution, it became negative. So the highest one was a 1 to 64. So an interpretation of this, so we have a comparison of acute and convalescent titers, and it can determine the evidence of recent infection if you have greater than or equal to 4-fold rise in titer, and immune response progression over time. For best practices, we want to collect paired specimens carefully, labeling them with date and phase. We're going to follow protocol-specific dilution and assay procedures to ensure accurate titer determination. We want to make sure, of course, document all dilutions, titers, and interpretations in the laboratory records. So antibody levels are measured using titers derived from serial or single dilutions. Acute and convalescent specimens are compared to assess immune response. And the correct technique and accurate recording are actually essential for reliable diagnosis and clinical interpretation. There are different test complexity classifications. The first one is your waved test. Its characteristic is that it is simple and it is a low risk test. So an example of this in the serology lab would be like a basic rapid assay. The requirements for this type of testing is it has minimal training and it usually does not require formal laboratory certification. The next one is your moderately complex test. This is often automated with built-in controls. So an example of this would be like ELISA or an automated immunoassay in the serology lab. The requirements of a moderately complex test is there is some technical skill and understanding of instrument operation, but they don't necessarily have to have that, laboratory background. A highly complex test, so its characteristic is it requires considerable judgment for interpretation. Examples of this are rare or specialized serology tests requiring expert analysis. The requirements for high complex testing is you are a skilled laboratory personnel, you have the detailed knowledge of procedures and interpretation, and have gone through all of the training and education needed. And then we have provider performed microscopy, or PPM testing. The characteristics of this test is that it involves direct slide examination by the healthcare provider. So examples would be like a wet mount or other microscopy type based assay. The requirement is it has to be a provider, so a nurse practitioner, a doctor, people like that, and they must be trained in slide interpretation. So best practices for this is it always performs tests within the scope of personnel training and certification. Make sure to follow CLSI and regulatory guidelines for each complexity level, and maintain proper documentation of test results and observations. So once again, our tests are classified by complexity. We have waived, which are simple, moderate, which are usually automated, high complex, which require expert judgment, and provider performed microscopy, which are slide-based examinations. Proper classification can ensure accuracy, safety, and regulatory compliance. And then we have point of care testing. So point of care testing is laboratory assays performed near the patient rather than back in the lab. This can include home test kits, handheld monitors like blood glucose analyzers, and bedside rapid assays. Advantages of point of care testing is it gives you rapid results, so it enables immediate clinical decision making. It's convenient for emergency, remote, or outpatient settings, and can actually reduce turnaround time compared to central lab testing. Disadvantages of point of care testing is it comes at a higher cost per test compared to batch testing in the central lab. Quality control and quality assurance are also more challenging for point of care. It requires regular calibration of the devices, and personnel must be trained to maintain accuracy and reproducibility. For best practices for point of care, we want to follow manufacturer instructions and CLSI guidelines for point of care testing devices. We're going to maintain logbooks and QC checks and device maintenance, and also make sure we train staff or patients on proper use and interpretation of point of care results. So just a quick overview summary here is point of care testing allows rapid near patient testing using kits or handheld devices. Benefit would be speed and convenience, and a disadvantage would be cost and quality management. So proper training and QC practices are essential to ensure reliable results. Some characteristics of waived test. Again, these are the ones that are kind of a low risk, easy to perform, but the wave tests are laboratory assays that actually meet all of the following criteria. First one is its simplicity and accuracy. So we're going to employ methodologies so simple and accurate that the likelihood of erroneous results are negligible. It also is going to have a low risk of harm. So essentially it's going to pose no reasonable risk of harm to the patient if the test is performed incorrectly. It's going to have FDA clearance, so they have been cleared by the FDA for home use. Some implications, so it can be performed by minimally trained personnel or patients themselves at home. This typically includes rapid assays, test strips, or home kits. But they must still follow manufacturer instructions and quality procedures to maintain reliability. Just a quick summary here. So we got wave tests are simple, accurate, low risk, and FDA cleared for home use type of testing. They are regulated under CLIA to ensure a minimal risk while enabling widespread testing accessibility. So despite simplicity, proper handling, label, and documentation still remain very important. So the Joint Commission standards for wave testing, so we have identification of tests, so we must clearly define which test will be performed in the laboratory. We have to include routine, confirmatory, and specialized assays in the test menu. We're also going to have procedures for each test, so we need to maintain a standard operating procedure for every assay. Those standard operating procedures, or SOPs, should include sample requirements and preparation, reagents and equipment, step-by-step test methodology, and safety precautions. For confirmatory testing, some positive or unusual results may actually require confirmatory testing in the lab, and this helps to ensure accuracy and reliability of a critical result. For instrument maintenance, we have regular maintenance, and it's essential for to prevent that instrument malfunction and ensure consistent and reliable results. This includes scheduled calibration, cleaning, and service logs. For quality control checks, we're going to perform routine QC checks according to CLSI guidelines. We're going to use controls and standards to validate assay performance and document all QC results and corrective actions if needed. Just some best practices. So we want to make sure we maintain an up-to-date test menu accessible to all personnel. We want to follow written procedures strictly to reduce variability. And we want to make sure we record or document all QC activities and instrument maintenance in the laboratory logs. So required staff competencies. So these competencies must be assessed at orientation before the employee starts performing any wave test by themselves, and then annually thereafter. We must have documentation of this assessment, and this is required for each evaluation. There are different methods of competency assessment, so the competency must be evaluated using 2 or more of the following methods. So we have performance of a test on a blind specimen. So personnel perform a test on a specimen with unknown results to evaluate accuracy. Periodic observation by a supervisor, so direct observation of routine test performance to ensure correct technique. And monitoring of each user's QC performance, so we're going to evaluate the user's ability to maintain proper quality control during testing. Could also be a written test, so we could assess the knowledge of test principles, procedures, and safety requirements. Just some best practices. So again, we want to maintain those records of all competency assessments for regulatory compliance. We want to provide retraining if there are deficiencies that have been identified. And we want to ensure all personnel are aware of test procedures, QC requirements, and troubleshooting. Just some examples of non-instrument based testing. So we have malaria testing. This is, well, really the gold standard method for malaria testing is microscopy. So this would be an examination of the blood smear under a microscope. This is once again considered the gold standard for malaria detection, and it provides information on the presence of malaria parasites, the parasite species, and the parasite density. We can do rapid diagnostic test as well. This was introduced back in 2007. So the Binax Now malaria rapid test is approved for use. It can detect a specific antigen produced by malaria parasites in the blood. It can provide rapid screening results, which is useful in settings where microscopy is unavailable. Negative results must be confirmed by microscopy to avoid the false negatives. So these, screening tests are just really screening tools. They're not definitive for all cases. Then we have HIV testing. So HIV is commonly performed in the community-based organizations, field testing and outreach activities, STD or like other clinics, mobile clinics, non-traditional testing sites, and community or even college health clinics. Testing methods, so we have rapid HIV tests, which are widely used for screening. They provide a quick preliminary result, and they are useful in non-laboratory or even community settings. For a confirmation of a positive result, so positive rapid test results must be confirmed with a 4th generation immunoassay in the lab. The reason for this is rapid tests have lower clinical sensitivity, so confirmation ensures accuracy and reliability. Some best practices, we want to make sure we train the personnel to perform and interpret rapid tests accurately and ensure proper documentation and linkage to care for positive results. So making sure that they get that confirmation testing if they do have, a positive result. And then we have pregnancy testing as a non-instrument based test. So we actually use immunoassays for this. So an original pregnancy test were immunoassays designed to detect HCG. It detects HCG qualitatively, so positive or negative is not going to give us a number for this type of testing in urine or serum. So we also have an example would be the OSOM or OSOM card pregnancy test. This is called a solid phase sandwich format immunochromatographic assay. This function is to provide qualitative detection of HCG and urine. An advantage is it's rapid and easy to use, and it requires minimal equipment, and it is suitable for point of care or clinic use. So the principle of how it works is it has a sandwich format immunoassay. So the HCG in the sample binds to the antibodies on the test strip, which then produces a visible line or indicator if that HCG is present. This can detect pregnancy as early as the first week after implantation. Again, best practices, so we're going to, once again, follow those manufacturer instructions carefully. We're going to use fresh or properly stored urine or serum specimens. And then you can confirm positive results with clinical correlation if needed. So if you get a positive, urine test, you can always come to the lab, with your doctor's order and get a serum test, and we can do actually a qualitative or quantitative test with that. We want to make sure that we maintain QC checks for batch and lot validation. So just in summary, pregnancy testing relies on immunoassay principles, typically using a solid phase sandwich format assay. The OSIM card test provides rapid qualitative detection of HCG. And again, we need the proper technique, specimen handling, and QC to ensure accurate and reliable results.